Georgia's children. We're very interested in Latino health, so we're really excited to be here volunteering.
We are gathered here today and tomorrow, not only to hear a great group of speakers, not only to celebrate at the reception tonight, but to work really hard on developing the strategies that we will, as a coalition, create to improve the health of all Latinos in Georgia. The summit is an open invitation to join us in this effort.
I would like you to enjoy the summit. I would like you to learn. I would like you to network. But most importantly, I need to hear your voice, to know what we need to do for the next couple of years, because what comes out of this summit is going to be our working papers for the coalition. Thank you again for being here.
I'll attention to a number of issues and opportunities. The first and foremost being that many of the health disparities experienced by Latinos in this state have at their the base are a number of root causes: poverty, unemployment, transportation, lack of education, and the like, and they must be addressed in order to address these disparities.
There's also evidence nationwide that foreign-born Hispanics have better health outcomes than US-born Hispanics. In addition, immigrant Hispanic health tends to get worse the longer they're in the US, who are reaching 50, 55, 60. We can prevent a good amount of that cardiovascular disease, diabetes, cancer. These diseases that we anticipate will come down the road are still preventable today if we put our attention there.
We look at where these people come from, and we actually work together with their communities of origin. Because really, working with people in the state of Guerrero, addressing the health issues of Mexicans from Guerrero living here may be more effective than just having this umbrella belief that, oh, we're going to address Hispanics, and you know, it may not be culturally competent. So addressing cultural competence really requires being very local, and therefore working with the local communities may be important.
Determinants of health agenda, it is about poverty. And in this case, it's about youth, because so many of the young people, so many of the population are young. So we need to think about young or youth-oriented programs. The policies that impact the schools, the policies that impact the parks and recreation departments, the churches where families go, the work sites where we have the working young families. And then also I think the prevention aspects that are mentioned, it's not about so much the hypertension and the cancer and the diabetes, even though we know that everybody's going to get those diseases. It's about children's obesity, and it's about women's health. So this report tells us that those are our priority for prevention.
These numbers represent real people, real families in real communities. Those of us who are clinicians often care for the preventable suffering, the adverse events that affect families because of these disparities. So they're real, they affect real human beings, real people. And let's make sure that as we discuss these numbers, we also have stories to tell of the real human impact.
What I think, number one, what we need is licensed mental health professionals. That's right in there. If you're going to be
this is going to be the first generations of Americans, first generations of Latinos that we're going to be burying our children. When I was in medical school, if you have a kid with type 2 diabetes, you will have a case report. That was immediately a case report. Now that's the norm. So when you encounter this situation, the life expectancy of the generation that have those babies are women, if they are healthy, at 60 years of age, they have close to 75% chance to hit over 90 years of age of life expectancy. But if you have a kid under 15 already diagnosed with diabetes, life expectancy of that kid is going to be from 55 to 65. And that's what
the risks are of inadequate language assistance. And whenever I talk about language assistance, I talk about civil rights, but I also really talk about the business case for language assistance, because it's a civil rights issue, but it's also a health outcomes issue. It's a risk management issue. It's a healthcare management issue. For a variety of reasons. One, if you don't have effective communication, even in English, by the way, even if both sides speak English, if you don't have effective communication between provider and patient, the likelihood of adverse outcomes obviously increases. And I know a lot of you are physicians, and I'm sure you have firsthand experience with exactly that notion.